Good evening, everybody. So today I'll be sharing about with you the second part of Elimination Diet on how we can further enhance our elimination or detoxification process, and also how do we start reintroducing the foods. Because remember, this is not a lifelong diet. This is not a long-term plan. This is a diagnostic and an initial therapeutic diet. We want to support our body to make it as simple as possible to digest, and we also want to identify if our body is reacting to any foods. So one way to look at how we are progressing is the medical symptom questionnaire. So many of you, before my first consultation, I would have given a form for you to fill, and we would have got a score of all the symptoms you are having. If not, I will send you the PDF of this questionnaire so you can track your symptoms using this. This is not a questionnaire which is used in a hospital to grade any disease, but this is a questionnaire which is used to track chronic diseases which have multiple symptoms and the whole body is involved. And in these kind of conditions, this is a very good tool to track how we are doing, to do of this questionnaire beginning and then in the middle and then after we start introducing. So the first aspect is to support a detoxification. So water is one of the most powerful detoxifier. As we know, water content in the body increases the circulation. It improves our uh, blood flow into the kidney and liver, and that's how we are able to detoxify better with adequate water intake. But beyond just increasing circulation, it also is very important inside our cells. So if there is an inadequate water content inside the cell, intracellular detoxification processes also will get hampered. So that is why dehydration not just causes external symptoms like muscle cramps, dryness of the skin, dryness of tissues, and constipation, but it can also cause dehydration of the cells, which causes mental fog. It can cause dullness. It can cause fatigue. And many times we mistake hunger to, when we're thirsty, we might think we are hungry. So it's very good if you are still not reaching your meal time and you feel hungry, you should first drink water and see how you feel. Many times you will feel much better by just drinking water instead of having snacks in between. So a simple calculation to know how much water we need to drink is to multiply your weight in kgs into 30. So that is the amount ml of water we need to drink. But this is not very accurate in terms of personalizing your situation. So if you are an athlete, if you are exercising a lot, you will definitely need more. If you're living in a hot environment, humid condition, you'll need more. But if you're in a colder environment, you'll need lesser. And it also depends on what kind of medications you're taking. Some of the BP medications, heart medications, and some of the diabetic medications might increase the urine flow. So in such cases, you may need a little more water. So hydrotherapy is used in naturopathy. It is used in Ayurveda, where external and internal use of water is used, and it acts at multiple levels in the body. So a simple thing, if you have to improve your metabolic flexibility, you can do a combination of hot and cold shower. So we've always, listened to elders saying that you cannot mix hot and cold because your body will undergo a shock. But it is true when you are weak, when you are recovering, when you are ill, you should not shock your body. But when you're normal, it's and you want to improve your metabolic flexibility, a combination of hot and cold shower at the same time will improve your metabolic flexibility. And in the hospital, we also do something called colon hydrotherapy. So we flush about 42 liters of water over 45 minutes into the rectum, and that gradually brings out all the extra residual stools, and it gets out all the excess bad bacteria out of the anus. So the next aspect of detoxification is having enough fiber. So fiber, as you know, it is really important to prevent constipation and remove, and it helps us to form proper stools, and it's important for our intestinal motility to happen properly. But another aspect about fiber is it will bind to some of the toxins. So our body's main mechanism of detoxification, of course, the kidneys, and the other one is the liver. So the liver binds, removes all the toxins, and along with bile, it puts out into the intestine. But most of the toxins are reabsorbed because the bile is reabsorbed in the intestine. So when you have enough fiber, many of the toxins bind to the fiber, and then you get it out of the system. So one of the important reasons constipation has also become an epidemic is because of lack of fiber and processed food, increased intake of processed food we have today. And nutrition, all these years we have only thought about nutrition as something which gives energy to us. But we have to remember that we are a symbiotic living organism. We have more DNA material in the body of bacteria and viruses and fungi, which is the microbiome, which is present all over the body, not just in the intestines, on the skin, on the external orifices. So this microbes in the intestines will feed on fiber. So we need to remember to feed the good bacteria also. And when the good bacteria is healthy, it makes us healthy. So we have soluble and insoluble fiber. Soluble fiber is what feeds the good bacteria, and that good bacteria can dissolve the soluble fiber, and it forms a gel. And that gel actually coats the intestinal lining, and it improves the intestinal lining health also. And it also is important for all metabolic diseases. It improves the glycemic index. It reduces the easy absorption of carbs in the intestines. And insoluble fiber is not digested much in the intestines. It's slightly modified by the bacteria, but it comes out of the system through the stools. And this forms the bulk of our stools. And this is the very important when we have constipation. So you need to aim to increase your fiber intake as you go. We should have at least about 25 to 35 grams of fiber per day from our food. So how, if you have to equate it to the number of cups you need to eat, about 5 to 10 small cups of fresh vegetables per day. And you have to incorporate fruits and vegetables in every meal so that you have a mix of fiber in with every meal. And you have to choose whole fibers. In grains, you have to choose whole grains instead of choosing polished grains. But remember, we need to consider the other aspects of your gut health and healing. If you have autoimmune diseases, if you have a sensitive gut, then the insoluble fiber or the whole grain are not recommended, because it is very difficult to digest, and it may cause a little bit of inflammation in the intestines. So it is very important to personalize it. The very easy way to increase, and which is suitable for everybody, is cooked vegetables. But when you're only trying to reverse your cardiometabolic disease and constipation, then insoluble fibers and whole grains are good. But if you have chronic diseases like autoimmune diseases and inflammatory bowel disease, then you should be careful about what you're introducing and what you're digesting. And with fruits, it's very important to not juice the fruit, because that will remove a lot of fiber and it will shoot up your blood sugar levels. It's better to blend them and have them as smoothies so that you still have the fiber. So this is an example of how much grams each cup or half a cup will have. So the next aspect of detoxification is exercise. So exercise and movement is very important to not just improve our circulation, but also to strengthen our mitochondria and our muscles. So in terms of elimination, we tend to neglect one important form of meditation, which elimination, which is the sweat. So many of the toxins which we have seen, especially the industrial world toxins, tend to come out of the body through sweat more than stools or urine, because probably it's getting deposited in the tissues, especially in the fat and in the skin and in the hair. When you have sweating has a routine and incorporated into your lifestyle, we have seen that it a lot of toxins come out through sweat. And when you compare different forms of sweat, there are many studies done in Finland which shows that infrared sauna is able to stimulate the mitochondria, and it's able to stimulate some intracellular processes and enhance the sweating and enhance the elimination of toxins more than other forms of sweating. So that is why for all the our patients who are undergoing detoxification, especially from heavy metals, we recommend far infrared sauna in the hospital. So it's absolutely effortless. You just have to sit in a room for about half an hour, and you sweat more than a steam sauna or in exercise. But if you're fit enough to exercise, you are strong enough to incorporate cardio aerobic exercises, then that's the best way to sweat and detoxify yourself. The next aspect is the stress reduction. Uh, Stress is something which is absolutely a part of our life in today's world. We can never stay out of stress. We have to manage stress. So the skill we need to develop in today's world is stress management, because we can never run out of or escape from stress. And 1 in 5 people never engage in any kind of stress reduction activities. And today's people, when I talk to them, they feel entitled that they need to spend 2 hours in Netflix after they go home because they worked so hard. And the best way to stress and they feel the endorphin release is best way is happening when they browse the internet or they watch TV. But that does not do the job in so many different ways, because it's a stimulation to your mind and to your eyes and to your brain at the end of the day. And many times it is a negative stimulation. And many people can never switch off from work. 82% of the people get back or think about work even after they finish work. So, meditation is the reason we recommend meditation in the practice is because it enables your mind to stimulate the parasympathetic nervous system. It reduces the cortisol level, it reduces the sympathetic nervous system. And it is not just meditation, has many different forms. Just because you don't believe in religion, you don't believe in any particular form of God, doesn't mean that you don't have a particular way to meditate. Just simple way to develop love, to practice patience, to practice forgiveness, to practice gratitude, that itself can be a form of meditation. So in our practice, we do multiple ways of stress management techniques, right from emotional freedom technique to we have a sound therapy in the hospital, and we also have some guided meditation videos which we send. So another misconception in today's world is we think we are productive when we multitask. but multitasking increases the cortisol and adrenal hormone, and it actually reduces your capacity to focus. You have more mental fog when you multitask. And because you always have the bias in decision, you're not able to make proper decisions when you do multitask. You develop decision fatigue very fast. And when you're trying to multitask, you are again and again telling your brain that losing focus is good. Doing multiple things and not focusing on a single thing is good. So your brain is getting trained to lose focus and seek external stimulation. So the number one thing to improve productivity is to stop multitasking. The next aspect is about sleep. Sleep and circadian rhythm help us, and it affects us in multiple ways. Sleep itself is a huge topic. I will send you all a video if you have not attended the previous sessions on sleep, because that itself takes about half an hour to 45 minutes to tell you all ways to optimize sleep. So coming to the next part of the talk is how do we introduce foods? So we need to remember why we are eliminating food. For some people, it may just be to for the detoxification process. For some people, it may be to give the rest to the intestinal lining so that it is able to heal, and we are giving some time to heal. And for some people, it may be to identify what foods is reacting to the body. So based on this reason of doing elimination diet, we need to decide how much time we need to give before we start reintroducing the food. So, so the reintroduction of food may vary between 3 weeks to 6 weeks in most people, but in some people, like people with inflammatory bowel disease, it will vary up to 3 months, because we need to get rid of the allopathic medications and minimize the allopathic medication dose and wait for the stool formation to happen properly before we start reintroducing. So some of the symptoms you should be aware of before you start reintroducing the food is you should be passing proper stools. In Bristol stool, it should be a formed stool without any undigested food particles and sausage shaped normal color stools. You should not be having a lot of bloating, and you should be able to pass daily. So once you are reach this stage where you don't have any GI symptoms, then you can consider reintroducing food. So I will send a link to this PDF, which you can use as a symptom tracker when you're reintroducing your food. So the first day when you reintroduce the food, you can choose on two ways you can do it. If the elimination diet is getting very difficult to follow, sometimes I just ask them to reintroduce the foods which they crave or miss the most, so that the elimination of that food is not extended. And the second way to do it is if we know which food is actually causing problem, like we know that the dairy and gluten are causing bloating and intestinal dysbiosis, then we keep those two for the last. And the other foods we start introducing. So on day one, you will have to eat a good amount of the food. So if you're thinking about wheat, you can eat about 2 to 3 whole wheat rotis, or 4 to 5 slices of whole wheat bread. Or if you're thinking about milk, then you can have about 200 ml of whole milk. And then you see if you have any reaction. If you don't have any reaction, then you can incorporate the food into your diet. If you have the food reaction, then you have to remove the food and wait for the reaction symptoms to come down before you test another food. And you can't test two foods at the same time. It's very important to test each food individually, because you'll get confused about what food is causing what symptom. And if you develop a symptom because of a food, for example, you develop bloating because of having milk, then you have to wait for that symptom to come down after you stop that food before you reintroduce another food. So this is an average portion size of reintroduction, what you can follow. So some of the symptoms, if you are not tolerating the food, could be headache, you can have sugar craving, you can have rashes and eczema, especially in autoimmune diseases, and you can have a little muscle pain, which has got better, can reoccur after you introduce food. You can have digestive symptoms like bloating, heaviness, and you can have unformed stools, and you can have mood disturbance. So this I've already told you that you need to wait until your symptoms get better before you reintroduce the food. And if you develop the symptoms, it's very important to stop the food. So if you find that some food is not suiting your body, it's not even when you're normal, you reintroduce the food and you're not going okay with the food, then it's better to eliminate it for at least 3 to 6 months. Then in that period of 3 to 6 months, you work on helping your body in recovering furthermore, and then you might be able to tolerate that food. But if the food is not causing any problem, then it can be a part of your diet. So this is how you can use the symptom tracker. On day one, you have introduced eggs. So you mention what symptoms you are developing on day one, day two, day three, day four. And then if you stop it on day two or day three, then you wait until your symptoms resolve and then move to the next food. The same thing, you can do it again for another food. So if you successfully finish elimination diet, it doesn't mean that you get back to eating a lot of junk and a lot of things which you have eliminated before. The most important aspect is to follow a holistic and a healthy diet and lifestyle throughout our life. Only then we can stay healthy and avoid these chronic diseases from coming back. So, like as you know, that food has become a very complicated topic today. So one person says vegan is good, one person says carnivore diet is good, somebody says keto is good, somebody says whole plant food is good, and it's very important to see. It's very important to personalize the treatment based on the person. If you observe the today's nutrition industry or the diet recommendations by various people, all the diets get success with cardiometabolic diseases. Like if you look at various people who talk about diabetes reversal, whole food plant-based diet are able to reverse diabetes, keto diet is able to reverse diabetes, and to a certain extent, vegan or the carnivore diet is also able to reverse. So the important thing here is we are removing the problematic food in all the dietary recommendations. But in many cases, we see that this general food recommendations is not working for everybody. Many people who follow YouTube channels and follows a particular diet, they come to me and they say it's not working. Initially, I felt good, but I'm not able to sustain. When they go into vegan diet, initially they feel very good because they detox, and then they develop D3 deficiencies, B12 deficiencies. When they go to carnivore diet or a keto diet, initially they feel good because of the energy rise, but then they end up getting a lot of mood swings, hormonal disturbance, and then they come back. So it's very important to personalize the diet, and these interventions are different. The therapeutic or diagnostic diets are different from a lifelong diet. So in functional medicine, we believe that food is energy, food is information, food is connection, and food is medicine. So we have a fundamental diet plan where you don't eat the problematic stuff, you don't eat simple sugars, you don't eat junk food, you don't eat inflammatory food, and you have a balanced diet, which is a sustainable diet. Then we have these first step interventions. The elimination diet is a first step intervention where we only want to start off a detoxification process. We want to diagnose food sensitivities. We want to give rest to the bowel. So these are the diet first interventions. And then we move to an advanced plan. For example, you have IBS, we go to a low FODMAP diet. You have Candida overgrowth in the test, we go to a Candida diet. If you have diabetes, Alzheimer's, we go to a mito diet. And even for cancer, we go to a cyclic keto diet. If you have autoimmune disease or heavy metal problems, we go to a detox diet and a renew diet. So we need to personalize and we need to choose what phytonutrients we want to use to heal the body and then decide the diet. So it cannot be a very general uh, uh, instructions for everybody. That is why it's important to work one-on-one and also have this knowledge sharing session. Thank you so much.